Well, welcome to Experience Psychosis. Is that loud? That's a little loud. I'm a loud man. Welcome to Experience Psychosis. I know some of you are in here for board study time, and that's totally cool because I'm trying to make my talk as relevant to board studying as possible. I know bipolar disorder is certainly a low-yield topic on boards. I'm sorry for that, but going to do the best I can. So this is the start of Mental Health Week. Today is obviously my talk on bipolar disorder. Tomorrow, please wear green in solidarity support of mental health disorders. We're going to be doing like a positivity board out in the back, and then also writing a letter to your future self on inspiration or where you're at today, talking to yourself in the future. On Thursday, we're doing a neurodiversity panel that I'll be kind of interviewing other students on stage, talking about their experiences. And then on Friday, we're doing a barbecue, and hopefully people will bring their dogs. So if you own a dog or other pets or whatever, please go ahead and bring that on Friday. But let's go ahead and get started here. This is a picture of Logan Noone, 20 years old or so. I had worked my ass off all summer to save up money to go study abroad in good old Scotland. And this is a picture from St. Andrews, Scotland. So St. Andrews, if you don't know, is where they invented golf. Okay, so this bottom photo is a picture of the 1st and 18th hole. So the first one, you tee up over on the left, and then the 18th green is over there. The top photo is just, it's right on the water. It's a really scenic area. Now also, here's pictures of me golfing over when I was in Scotland. And even when I was in Scotland, if you don't know, they're not that keen on basketball over there. And I was actually able to make their intercollegiate basketball team. And if any of you guys have seen me play basketball, you know that this is a complete fluke because I'm terrible at basketball. Now, these are pictures. I was traveling around with my friends. I was going to soccer games, really having a fun time. And so what I'm doing trying to show all these photos is from like a Facebook perspective, from like a 30,000 foot perspective. I was living the life. You know, I had everything going for me. I'm sure everyone assumed that I was happy. However, that wasn't really my reality. On the inside, I just absolutely started to hate myself. And when I first moved to Scotland, I had a lot of trouble sleeping. And I thought this had to do with jet lag, but really it kind of grew into something much, much worse and much, much more severe. So I started having all these weird kind of intrusive anxiety thoughts. I thought my friends were talking bad about me. I thought my girlfriend was cheating on me. I thought my family randomly started hating me. It was just absolutely terrible. And these thoughts were just so consuming that I couldn't sleep at night. So my insomnia got worse and got worse. I just started to isolate myself. You guys all know me. I'm a very social person, but I just would stick all day in my room, not talking to anybody. And being that it's Scotland, and they're a little bit smarter in some capacities than us Americans, their drinking age was only 18. So instead of admitting that I had some anxiety and insomnia going on, I just chose whiskey. So to really self-medicate and alleviate my insomnia problems, I was just turning to whiskey. Now, in reality, it had an effect. It wasn't an amazing effect, but it did actually help me go to sleep. But over a long period, it just kept confounding and getting worse and worse and worse. And so over that 2-semester period, I really started to exhibit a lot of depression symptoms. I just absolutely hated myself. And when I lived in Scotland, I was in a freshman dorm, and I'll never forget there was someone further down the hall than me that actually, they're not sure if it was intentional or if it was a drunk accident, fell off of one of these cliffs in Scotland, in St. Andrews, to his death. And I remember thinking, well, I could do that. You know, that would be kind of an easy way to go out, make it look like an accident. And I was absolutely so embarrassed and ashamed that I was having these thoughts, but I still didn't tell anybody. And I really think what kept me from doing something stupid is that suicide actually runs in my family. My uncle, David, had bipolar disorder and spent years and years and years going on and off his meds, in and out of the psych ward, and eventually succumbed to his disease and ended up killing himself. So I remember thinking about when I was potentially going to commit suicide, I just remember thinking of my mother. My mother would be sitting at home crying. It was really a tumultuous time in our life because her mother died, her older sister, and then her brother ended up killing herself. I remember going up to my mother, and she would just be weeping. And I'd be like, well, Mom, what's going on? And she would just say, I wish I could have just said anything to my brother David that would have made him stop killing himself or stopped, attempting to kill himself. And that's really what kept me from doing something stupid in Scotland. Now, did I go see a doctor? Did I go seek any counseling or anything like this? No, I didn't even tell any of my friends. I just kept living my business. Eventually, I made it back to the United States, and I was still living kind of this weird life where I was depressed most of the time. Around my friends, I could kind of pull myself out of it, but I was still just really, really depressed, using alcohol in excess to essentially put myself to sleep. I was also at that time in my life I think we've all had these, like the first real relationship of our life. We think it's like amazing, that young, teenage love. I got out of that relationship with my girlfriend, and suddenly I felt euphoric. I felt like I was fixed. I felt, I'm no longer depressed. I feel amazing. And it was also during the same time I graduated undergraduate school out in Massachusetts. And so I fit along with all my classmates who were all, celebrating the end of their college graduation. But what really started to turn into a celebration to a more psychosis is once things I couldn't sleep. So the first night of partying, I didn't do, people always ask me all the time, were you doing coke or meth or anything like that could be causing you insomnia? I wasn't. I stayed up an entire night that first night, and then it just continued. And so I kind of fit in with everyone around me. I was partying, life of the party, whatever. But then by about days 2 and 3 of not sleeping, it started to get weird. I started to have all these grandiose thoughts. I thought I was Mark Zuckerberg. I thought I had come up with the next great idea in the world. I thought I could invent this social media website that talked about emotions, and that's how everyone would get fixed. And I was actually calling my friends' parents, harassing them to invest in my company that I hadn't even made up. And it got to the point where they had to actually block my number, and they reported me to the police for harassment. So it was really embarrassing, but it just kept getting worse and worse. And I kept thinking these ideas were so amazing that the FBI was following me around, hacking into my computer. So I was just in this state of paranoia, driving all around. People couldn't really follow in my conversation. And what first aid really kind of describes it as a word I kind of like, or a phrase, word salad. I was kind of having conversations in my own head. My friends were trying to stay with me and see what was going on, but I was just really in my own head talking just incoherently. No one knew what was going on. Now, thankfully, my parents and friends all knew something was going on, and I got home safely, and they brought in this team. I'm still not really sure to this day what they were, but they were a mobile psychiatric intervention team, okay? And they came to my house, and they sat me down, and they laid out kind of a series of options. They were like, okay, Logan, we can try to, you can clearly note that this is some weird behavior, right? This isn't normal, typical Logan behavior. We can try to get you into a psychiatrist, but the psychiatrist's office are so impacted, we're likely not going to get you in for another 3 or 4 weeks. Your second option would be you could go into the psych ward. Ooh. Or the third one, you could just pretend all of this is normal, okay? And I really thought in that state of mind, at least at the beginning, it was just normal. I could just sleep it off, whatever. But it was actually my close friends that called me and said, listen, Logan, we love you. We want you to be successful. I had a job lined up after this graduation. We want you to go work at that insurance company. But you need to take this serious. If you had chest pain, if you had a heart attack or any trouble breathing, you would have no qualms in going to the emergency room. You clearly have a problem going on with your brain right now. You're being so hesitant to actually go seek out care. So, with the help of my friends and family, they convinced me to go into the psych ward. And the psych ward, I'll get more into that experience in a little bit, but it was the best, worst experience of my life, kind of. You walk into the emergency room, you show up, you're right next to the kid that broke his arm, and you think it's all fine. Then they realize that you're actually a psychiatric case. They bring you back to this further area to a door that looks like an industrial refrigerator. You open it up in there, and then they have a bunch of little individual rooms with beds that have straps on it. And that was really the most sobering experience for me in the world. I remember just in my mind was racing so fast, and I was still having this word salad kind of conversations with myself. But I wanted to do anything in my power to not get strapped down into that bed, because that was just absolutely terrifying. So I stayed in, I don't know the actual term, I just kind of always call it like the emergency room, atrium. I don't know, I guess next year when we're out on clinics we'll learn these proper terms. I only stayed down there for about 3 or 4 hours before I got moved up to the psychiatric ward on the top floor of the hospital. Other people spend absolute weeks there. before they actually can go up into the higher stage. So let's take a quick moment to board study. Okay, so good old first aid has decided to use the mnemonic dig fast to try to remember bipolar disorder manic symptoms. I think this is stupid. I don't know how you're supposed to associate dig fast with bipolar disorder. So here's what I'm thinking, okay? So I grew up in Connecticut, right? So how I want you to associate this is with this story. So we would always have, 2-hour delays or snow days, wherever it may have you in Connecticut. My mom was a teacher, so she would be one of the first people that would find out. She would call me and say, or, from downstairs, Logan, I'm going to need you to shovel the driveway. We got a snow day. Oh, whatever, Mom. I don't want to. Logan, come on. We got to get going like an hour later. Please. Or what did I do? We got to shovel the driveway. So I would go outside, run, and dig fast. I don't know. That's how I want you to at least try to associate this, because I don't know how we're going to memorize all these mnemonics towards certain diseases. But I tried. Okay, so if we go through this list of dig fast, you can see elements of my story that were in this kind of manic episode. So the distractibility, when I was manic, people were having trouble following my conversations. They didn't know what I was saying. I was being a little bit irresponsible. I went out during that week of manic episode, and I remember I bought 5 kegs on a credit card. I was just being very promiscuous, the fact that I was just out of a breakup kind of thing. But it really, I'll go into what hypomanic means for me later, and you can see kind of more hedonistic behaviors later. So grandiosity, I thought I was like Mark Zuckerberg. Remember, I was harassing investors, trying to get them to invest in my business idea that I hadn't even really thought through. I obviously was having a flight of ideas, racing thoughts. The activity and psychomotor agitation, a lot of people in manic episodes are kind of goal-oriented, even if that goal isn't necessarily good. I obviously had a decreased need for sleep, and I was very, talkative, kind of word salad as we described it. So why I put up this picture is I think the irresponsibility seeks pleasure without regards to consequences, is the most fun aspect of sort of manic episodes. And one reason why people don't necessarily want to get medicated, because part of the manic episode, at least when I was experiencing it, was fun at the end of the day. And obviously can get to a very dangerous level, but there was elements of it that were certainly enjoyable. So I really hope everyone in this room knows Nelly Furtado and Timberland, Promiscuous Girl, because that's what I kind of think of, one element of manic episode. And also gambling. When I've gone to a lot of bipolar disorder support groups, gambling is something that seems to always come up as a central theme of what people do when they're, on manic episodes. So now moving on, can anyone tell me what type of bipolar disorder I was diagnosed with in the psych ward? 1, yes, because bipolar disorder type 1 is the presence of a manic episode. Bipolar disorder type 2 is the presence of a hypomanic episode with a depressed episode. So what is hypomania? Oh, wait, did I miss one? Okay. I thought I had a slide in here about hypomania. I must have taken it out. My apologies. Okay, so hypomania is essentially like a mini manic episode, and this is also what I was kind of alluding to earlier, aspects of bipolar disorder that people actually like. So I view hypomania as kind of a surge of energy that I feel in my body just to get things done. And sometimes I can use that in a positive means. I can be very creative, or I can get kind of things done in the house, or it can kind of turn that excess amount of energy into an insomnia or into anxiety. And so, when people talk about bipolar disorder type 2, they still experience these hypomanic episodes, but not the full-blown manic episode that I was talking about earlier with the whole dig fast mnemonic. Okay, so when I was in the psych ward, the psych ward was not a fun experience. Like I said, it was the worst thing I've ever done. I'm really glad I went. I'm really glad I finally got diagnosed, but it was not an enjoyable experience. Psych ward to me was, I was locked up in a hospital wing for 5 days in a row. And I don't think anyone really enjoys the feeling of being locked up. I remember just all day pacing the hallways back and forth, trying to get exercise. I was super bored. All we seemed to do all day was watch Oprah and like Maury on television. I remember one thing in the psych ward, they had us do group community or group therapy exercises that I thought was really productive, but I still didn't get to see the psychiatrist as much as I thought I would have before I entered the psych ward. I think I only saw him for maybe 15 minutes each day I was there. Also, though, the psych ward did give me yoga. The first time I ever did yoga was actually in the psych ward, and I still practice yoga to this day. So, there was kind of good with the bad. I'm still glad I went. I think that there is certainly an element of my story that, there's a market opportunity that I didn't necessarily really need to go into the full-fledged psych ward, but there needs to be something in between going to see your primary care or going to get that initial psychiatrist appointment and the psych ward. So now let's kind of turn this conversation into the medication aspect. So the first medication that I was put on is aripiprazole, and I knew this as Abilify. So this is a dopamine 2 partial agonist. It falls in our atypical antipsychotics class. Now I'm not going to go on too much about this because we haven't taken the behavioral health unit. I don't really know what I'm talking about. But you can see the mechanisms. It acts, this aripiprazole acts mostly on a dopamine partial agonist, but it also has serotonin effects, dopamine, and then alpha and histamine receptors. When I was researching this in my own, level 2 osteopathic medical student level, they don't really know why this works, but it has beneficial effects on people with schizophrenia and bipolar disorder. However, I didn't really have the best experience with this. So I was experiencing acute dystonia and akinesia. I don't know if I'm saying that right. Am I saying it right? Probably not. But either way, I was experiencing muscle spasms and stiffness and restlessness, okay? So another one that it wasn't listed as a typical side effect, but it's something I at least experienced, was fatigue. And so keep in mind, when I was first put on this drug, I was starting as an insurance agent, as an underwriter, which means I was essentially sitting in a cubicle all day crunching numbers. So you can imagine dealing with restlessness and acute dystonia was extremely, extremely challenging. I would just sit there all day kind of tapping my legs, and I absolutely hated it. However, though, being in the perspective of a patient, I was really hesitant to tell my psychiatrist any of this was going on. I was just so afraid. Whatever I said to my psychiatrist, he would just say, oh, well, you're a risk to yourself. We need to put you right back into the psych ward. And the psych ward was such a negative experience, I just did not want to go back at all. So it was that fall, 6 months after I was in the psych ward. This is a picture from Florence, Italy. My sister was actually studying abroad at that time. And I'll never forget this experience because my family and I went out to, Italy to visit her. But for all of a sudden, I started to have new suicidal thoughts that they might have been attributed to the aripiprazole. Maybe it was just that I was in such a depressed state of mind after the psych ward. But I started to have extremely negative suicidal ideations. And I don't know if you've ever been to Florence, but you can easily get hit by a car. It's just so crazy, so wild that you could step out into the street and get smacked. And I was kind of having these same thoughts that I was having earlier of if I did want to hurt myself, I wanted to make it look like an accident. So I was in this state of mind where I didn't tell anybody that I was in the psych ward. And anybody that I had been diagnosed with bipolar disorder. And what that really stemmed from was actually my medical professionals. So my medical professionals kind of explained to me, and by medical professionals I mean the therapists, the psychiatrists, and the other social workers that were in the psych ward. Listen, you have bipolar disorder. You're going to have this forever. It's chronic in nature. It's not really going to go away. And that's something that it's relatively easy to accept because you can make a lot of comparisons to other disorders out there. The easiest one probably being, diabetes. Next, they said the most successful management of these type of disorders are going to be medicated probably for the rest of your life. Once again, that was kind of easy to accept. But then the last part is they kind of warned me out about the stigma that exists around mental illness. They said people could mistreat you. People could, stigmatize against you. Girls might not want to date you. Companies might not want to hire you. Apartment complexes might not want you to live there. It's probably just not the best idea to tell anybody about your bipolar disorder. So kind of keep that all in mind when I'm going through these depressive episodes. I was dealing with elements of suicide. I was obviously very, very depressed and extremely isolated based off of the advice that these medical professionals had given me. So I remember getting back from this trip and just being extremely angry at my psychiatrist. I was like, I don't know if it's because I'm depressed or I don't know if it's the medication, but I'm having, obviously muscular issues, I'm very restless, and suicidal ideations. Now, sometimes when you're dealing with the acute dystonia and the akathisia, can't say this, the psychiatrist will want to put you on either benzos or beta blockers. And I didn't want to be put on a second medication. I wanted to try to keep as little medication in my body as possible. So next we moved towards Lamictal, or Lamotrigine, which method of action is it blocks gated sodium channels and inhibits release of glutamine. We learned about this in our neuro unit for epileptic treatment. And really one of the main side effects, but the one we are most concerned about is Stevens-Johnson syndrome. So I remember I got put on this medication, and it was at that time that I actually moved from Boston over to Sacramento, California. And so at that time in Sacramento, California, I obviously had to get established with a new psychiatrist. So it was about a month into living in Sacramento, I saw a new psychiatrist. He's like, well, we can't keep you on Lamictal. You look like you have Stevens-Johnson syndrome. And I tried to explain, I'm like, listen, I'm just very, very Irish. I'm just red all the time. This is ridiculous. But even so, he said that you could be in a car accident or you could be in some other medical emergency. They could see that you're on Lamotrigine and think that you're having a Stevens-Johnson syndrome. It could all just go haywire. So then my psychiatrist switched me to valproic acid or valproate. It's been called Depakote. So this is, first years you might even recognize this one. It came up in SciFOM. Second years, I hope you really recognize this one. Came up a bunch in neuro. So once again, this is actually used initially for epilepsy, but has shown benefits in bipolar disorder as well as in migraine prophylaxis. So its method of action is it increases sodium channel inactivation and it increases GABA concentrations by inhibiting GABA transaminase, okay? So some of the side effects that are really notorious for everybody are pancreatitis, GI upset, hepatotoxicity, and weight gain. So every year I have to get my LFTs drawn. And I also have gained some weight because of the medication, but I don't know if I can directly attribute it to the medication because I'm kind of an idiot and I like Taco Bell too much. But this is the pill that I have been on for the last 6 years, and I've had some fluctuations in my medication level, and I'll go along and explain that. But this has been working well for me. Okay, so maybe some of you guys are thinking, I'm surprised lithium isn't in this kind of equation at all. And actually, many psychiatrists suggested using lithium as our first-line medication because I was exhibiting clear bipolar disorder type 1 symptoms. Now, I really had a strong aversion against lithium because of my uncle. My uncle who had bipolar disorder, who eventually killed himself. He was on and off lithium for his entire life. Now, keep in mind, he passed away when I was 10. So I never really had an opportunity to discuss with him, like, how did this work or what was it like? But, just realize that patients that we see will have strange, weird aversions to medications that might make a lot of sense to us, but they might have their own personal reasons why they don't want to take it. So at this stage, I was kind of really starting to figure out my medications. I was sort of starting to feel better, but I still didn't really know anybody. I started telling people more around me that I had bipolar disorder. I remember I moved into Sacramento to these guys who I met off Craigslist. I was like, well, what the hell? I'm just going to tell these guys I have bipolar disorder. If they don't like me, I can just move out and find new roommates. It's not that big of a deal. So I started to learn how people were very accepting of mental illness much, much more than my medical professionals had initially warned me. And a big part of that was because of balance. So this is a bipolar and depression support group, but really it's any kind of mental health condition. It didn't really matter. And it was a group in Sacramento that met every Wednesday, and there was about 50 to 60 people that met every Wednesday and just discussed issues about what was going on. It was really a powerful experience for me because I was able to meet people who had issues like me, and I was able to see kind of how I can live my life successfully with bipolar disorder. So what really led me to have an affinity towards becoming an osteopathic physician, though, is when I realized kind of the connection between the body and the mind. So you can see this picture on the left, that is a beer in my hand, and I weighed about 275 pounds. On the right, that's me weighing like 210, 205, something like that. So I went through a huge weight loss period while I was taking that valproic acid. So I always like to use this image to kind of tell people, despite the common side effects of weight gain of your medication, you can still lose weight. You still are capable of overcoming those side effects. So, when I lost all that weight, I always like to talk about how the mental benefits that I received from that weight loss were much, much more than what it might have improved my blood pressure or maybe my triglyceride level. I just felt like a new person. I had more energy, I was more confident, and I believed in myself. So it was around this time when I was, skinny Logan. I don't look like this anymore, sorry. But I don't know if you guys remember the Sandy Hook shootings, okay? This was, I grew up in Connecticut, so this was about an hour away from my house. To briefly remind you, remember this was the shooting at an elementary school where someone with a mental health condition, went up and took a bunch of innocent lives. So I remember feeling incredibly motivated at that time that I wanted to do something. I wanted to speak out about bipolar disorder and mental illness as a whole, and show that it's not all bad cases, that there also is success stories like me and like all the other people that I had met at that balanced support group. So that's when I really felt motivated to make a YouTube video. And I don't know if some of you have seen this or maybe you've heard about it, but I made this YouTube video kind of just giving the same speech that I'm giving you right now, explaining how I was diagnosed, what my treatment's been like, and how I have developed this kind of positive outlook. So my experiences with that is it went kind of pseudo-viral, okay? In a sense, it had got like 40,000 views in the first 2 weeks. What I didn't understand, or I was really confused at this stage, because I was like, dude, I only have 1,000 friends on Facebook. I don't know that many people. I'm not that cool. Like, how is this happening? What I didn't realize is FoxNews.com actually did a feature article on my story and why I was speaking out against this. That's when it really kind of ignited this fire under me, that I realized that there's a big opportunity in mental health to improve on the situation we have at hand. And so, being that I was featured on FoxNews.com, it really sort of put me in this state of mind where I was describing this before, like hypomania. I felt all this energy that I wanted to do something. And so, okay, here's the slides I was looking for earlier. So a hypomanic episode is like a manic episode, except mood disturbances are not severe enough to cause marked impairment, blah, blah, blah. So essentially, I can live still a normal life dealing with some elements of this hypomania. So I remember after this YouTube experience being on Fox News, I went into this hypomanic state where I was up for like 3 weeks in a row researching, how I could be a mental health advocate. I remember I bought like 10 websites online, all like Mental Health Matters and like, all this stuff, kind of in the sense of, really a week. And how I, as a future physician, or psychiatrist, hopefully one day want to track hypomanic episodes, is I want to ask patients to really take a hard look at their credit card statements. Because at least what I noticed for me is my spending levels go crazy during hypomanic episodes, okay? Sometimes they can be really creative, and that's kind of how I created that YouTube post, even maybe how I started creating my podcast. But they can also be very negative. I can go into very anxious states of mind or spending sprees and just other kind of stupid, wild, crazy things. So sometimes what I notice, and maybe you guys are hearing this kind of in my story, everyone can kind of relate to what hypomania means. We've all gone through stages of where we feel just maybe energized, more creative than normal, more anxious than normal. We can all relate to this. And one treatment that I've really liked and used over, my 6 years of having bipolar disorder is squats and cleaning. Because what I find is when I have that excess amount of energy, if I go to the gym and really try to do a good workout, try to push a lot of weight, I get so tired that I don't have the energy to feel anxious anymore. Or if I just go and clean the entire house, kind of same concept. I don't have the energy to have that mental wild craziness kind of going on inside me. So I don't want to paint this picture like I was in a depressed state of mind and then I figured it out and I made my way to med school and it's all perfect. Because it is certainly not like that. So, I don't know if you guys remember, we have a few first years in the room last year, or right now. last year around this time, I hated med school. I mean, head and neck sucked. Cardiology was kicking my butt. I remember I was really regretting my decision coming here. And I was starting to have symptoms again, not nearly necessarily as severe, but I was feeling very depressed. I didn't know if this was the right decision. It was very, very taxing. Now, to add on to this, I also kind of realized the reciprocal of what I was talking about earlier. How, when I was bench pressing, when I was working out, it was making my mind feel better. But when I also have physical pain, that can really have negative impacts on my mental state of mind. So, right around this time, I was also dealing with a lower back pain. And it was kind of impinging on this nerve, and I couldn't move. I couldn't even really sit in any of the chairs. It became extremely taxing just to even come to school and do normal activities of sitting on my butt all day. So, what I eventually found out that this injury was actually a pylondital cyst. And so I don't know if you recognize this photo. It's from the sketchy path. What a pylondital cyst is, does this have a pointer? I don't know. It's a cyst right on the top of your butt crack in the nidal region, whatever that's called. And so what they do is it was causing an extreme amount of pain in my lower back. And eventually we kind of were able to get it figured out. We did do an incision and drainage, which alleviated some pain, but essentially it came right back and caused a lot of pain that entire summer. I wasn't able to work out, and once again, being that I wasn't able to take care of my body and I was in a lot of pain, it caused a lot of anxiety. I was dealing with insomnia because I couldn't lay down the way I normally wanted to. Now, since we're all medical students and we've seen some crazy, gross stuff, I think we need to take it up a notch, okay? So, stare into the pits of hell. Okay, so this is the beautiful pylondital cyst. Thankfully, I have great friends on campus that were able to pack this for me because we had to leave it open. But this was extremely taxing, not only for my ass, but also mentally, because I was dealing with a great amount of pain. I'll take this off the screen, I'm sorry. Good, no, happy image, okay. I was dealing with a lot of pain and trying to manage kind of the stress and anxiety that medical school entails. So, why I tell this story, though, is over the last years of my life, being in medical school, I've had some of the best times. This is a picture from my wedding, and I was able to get married on September 15th of last year. But also, I had some of my worst times. I had dealt with a hole in my butt for like 2 months. I was dealing with, was this the right decision coming to medical school? I think these are all things that we can kind of relate to. So, being in the state of mind we are now, I don't have all the answers to the medical, or how should I say this? The burnout problem in medical students and physicians as a whole. I really just think that at the end of the day, we need to kind of communicate with one another about what's going on. I wish I could sit here and kind of tell you, this is how to maintain a proper balance for boards. This is how to get through the repro unit without kind of losing your mind. But I don't really have any of the answers. What I do think the answer is just communication. You can see some of the pictures here are classmates, like there's Wyatt in the bottom corner, in the bottom right-hand corner are all my classmates at school. But I also think it's important to communicate with people outside of your life and just kind of have that normal balance of we can't be 100% medical students, we can't be 100% board prepping in our entire lives. We do have to have a proper balance of things going back and forth. And so really that's what I want you guys to kind of take away from my story. Thank you guys so much for kind of tuning in today. And that's kind of what I was going on the end here. Is really, I want everyone to try to just talk about mental health more than just necessarily listening to my story. And that's why it's been so beneficial for me to have a podcast where instead of me just kind of blabbering like I just did for the last 40 minutes about my own experience, I'm able to create a platform where other people can share their own experiences as well. And so that's really been a positive experience for me, trying to motivate other people to speak out about their experiences. There's a lot of people in this room that have been on the podcast with me, and so I want to thank you guys so much for participating in that. And that's 12:40, so we got some time for questions if anyone wants to ask anything, or we can just call it a day here. What's up, Anna? I don't know if those are on.
Yeah, it's on.
Okay.
Okay. So in the world of like psychology and psychiatry, there's a lot of debate about self-disclosure and whether or not the provider should self-disclose and how that could be beneficial to some patients, which I think is probably what you think, right? You share your own story, and the patient would be more apt to open up. But then there are other patients who may not benefit from it, or other circumstances where it may not be appropriate. I'm curious about how you're going to deal in the future with maybe preceptors who are very anti-self-disclosure, and how you deal with circumstances where maybe you shouldn't self-disclose, but you have such like a public name or presence that might be hard to avoid.
Yeah. Well, I guess let's start far and then work our way backwards. Because in my future career, I hopefully would like to, maybe have a private practice, or at least be at the head of an organization where, being completely open about my experiences won't be detrimental at all. And, because I won't essentially have any boss, I can just do things my way. And I think being that I have a podcast and I'm very open about this, hopefully the patients that come in to see me will already know, this is what I'm going to get. This is someone who lives with bipolar disorder, and so they have that kind of expectation. Now, dealing with the preceptors, I think it is going to be a challenge. And I think a lot of them are not going to agree with the attitude that I have, that public disclosure is the best method. And I think with me just expecting that it's going to be a little bit of a shit show at the end of the day, people might say things like, you shouldn't say you have a disorder. They might not, recommend me for a residency for whatever reason. But I think about, people were telling me that on my pre-medical applications as well, that you should never disclose, no medical school is ever going to take you serious. And I do think some medical schools probably wrote me off the second that they saw that. And I imagine some residencies and preceptors might do the exact same thing. But, being here at PNWU, I haven't felt that negative stigma. So I almost take the attitude that I know it exists, and I know I'll probably experience some of it with some preceptors, but I don't think it's going to be 100% of my preceptors. And so that just makes me at least more confident that I can handle it moving forward. Any other questions? Dr. Arreo?
When did you have the realization that you needed help, that you were, locked in a situation that was kind of beyond your control?
I would say when the really severe paranoia was kind of coming in, that's when I knew that it was really a kind of a psychotic feature. I remember I drove around for 7 hours in a row, and I was afraid to go to my house in Connecticut because I thought the FBI was going to be staked out there. I remember I had all my computers and my cell phone, and I purposely put them in like airplane mode because I thought the FBI was like hacking in with Wi-Fi or whatever. It was just this total kind of crazy, wild state of mind. And that's when I was at least kind of able to convince myself, like, oh, I'm a little crazy. And even by me saying, like, I'm crazy, there's a lot of people within the mental health community that don't like that, associating mental health with the word crazy. But that's at least my experience, where I tried to just say, like, you know what, I think we all have a little bit of crazy in us. Maybe I just have a little bit more than the average individual. And, this is an example of it. And that's what motivated me to kind of take the treatment serious.
Well, why do you think you were able to recognize that when so many people aren't? When so many people, they're unwilling to accept that there might be something wrong?
I think a lot of it had to do with my experiences seeing the damage that my uncle did on the family. Because I was able to see, with him killing himself, the impact that had on my mother, on the entire family, and almost the catastrophic sense of mental illness. If I don't take my mental illness serious, I potentially could end up like my uncle. And so that was a motivating factor for me. But, a lot of people in that crazy kind of wild psychotic state of mind can't realize that their behavior is psychotic. And, I think we're going to have this same issue as psychiatrists. And I get that same question asked, I think, almost every speech that I give. Like, how can I convince someone that they are dealing with a psychotic episode? And I wish I had easy answers. And part of the reason why I'm here as a medical student is I want to develop objective means, maybe brain scans, maybe gene testing that can kind of help convince people more than just a subjective history of their present illness that, hey, this is a psychotic break.
Did you notice anything when you were a kid, or did your parents know anything when you were a kid that would have been indicative of your bipolar disorder?
I mean, I certainly had elements of depression when I was a child, but it's hard to really kind of say if it was any different than anybody else's. Being just kind of in the world we live in, especially as a male, I didn't really disclose how I was feeling about a lot of things, but I've always had kind of a body dysmorphia kind of thing. I was always shopping in the husky section growing up, so I kind of always had that in the back of my head at all times. I remember, though, when I was 16 years old, I got into a car accident. And right after that car accident, I actually had elements of PTSD every single time it rained or every single time I would drive past that one strip of road that I crashed. But even said, at that stage, I didn't tell anybody about that. And I kind of just internalized everything. And, maybe that made it worse. Maybe that made my manic episode come out stronger, when it did. It's really kind of hard to say. But I think a lot of people kind of deal with issues like that where they don't disclose things that are going on, especially at a young age. Any other questions here? Well, I want to thank you guys so much for being here. Hopefully at least some of the stuff from this presentation will show up on your boards. No promises. I do get it's low yield, but I really appreciate you guys all tuning in. If you have enjoyed my work and my podcast, please share it with friends or give it a rating or whatever. If you are here and you want to learn about being an officer in the psych club, just kind of hang out after, and yeah, we'll talk. So yeah, thanks again so much for coming.